Hi there, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today we're discussing stem cell therapy for autism in the Philippines. All right, I put together this word cloud because I love word clouds, but these are all of the topics that families ask us about when we're doing a consultation regarding children and autism. All right, so we're going to go through each of these topics one by one. So let's start with the protocol. We use a combination protocol of an intravenous drip along with an injection into the back. It's called intrathecal, and our highly skilled anesthesiologists perform this. We do use conscious sedation, not general anesthesia, but conscious sedation so that the children are very comfortable, they don't feel any discomfort, and they don't remember the procedure. So where do we get the stem cells? What's our source? Well, these are derived from umbilical cord tissue from women who are undergoing a C-section. The women are consented, so there's no surprise that they're being a donor. Normally the umbilical cord tissue is simply discarded as medical waste, but in this case it's donated and it goes directly to our labs in the US for processing. What kind of cell types do we use? So we use what's called mesenchymal stem cells. Some people say mesenchymal. And basically those can come from yourself, from the patient, either bone marrow or adipose tissue. But years ago we stopped doing that and do the umbilical cord mesenchymal stem cells because they're very potent and powerful and they work fantastic. What's the safety? Well, our quality control testing is equivalent to the USA FDA. We're registered with them. We test for communicable diseases, sterility testing is performed, and then a certificate of analysis is generated. Here's an example of that where you have the viability testing to make sure that we have at least 75%. It's usually about 90%. And then actually for this product it was not cultured, so there is no passage zero basically. If we do culture it, the passage number's on there. And then for product testing, you can see that there's various diseases tested. There's bacteria, fungus, virus, and then there's endotoxin testing as well. And one more thing about that is that our testing is better than really any other lab in the world. Or it's at least as equivalent in the United States. But most labs in other countries skip some of those steps, and that's very concerning. All right, so what about patient safety and side effects? Well, when you look at the side effects of stem cell therapy for autism, there can be low-grade fever, maybe some nausea, headaches, chills, lightheadedness, maybe dizziness, maybe some temporary hyperactivity, which resolves, but wanted to mention it. And those are really what we've seen. With the safety testing, we have never had a deep infection or a disease transmission. Knock on wood, but it's been a very safe procedure. So when you look at the tumor question, we get this all the time. Mesenchymal stem cells that we use are basically extra embryonic. They do not induce tumors, unlike the embryonic stem cells. We don't use embryonic stem cells. So these cells are non-tumorigenic. There was another evaluation in the paper below this one, which stated, in conclusion, umbilical cord blood mesenchymal stem cells do not exhibit tumorigenic potential based on in vitro and in vivo assays under their experimental conditions. So they're very safe from that aspect. Can you reject stem cells that are given? Well, we wrote this paper to the right. We did a full literature review of all peer-reviewed studies on stem cell therapy for ASD. And one of the things that we noted was the immense amount of safety and the fact that these cells do not get rejected. They don't have MHC2 markers. They don't have red blood cells. So there's no need for cross-matching or cross-typing. They do not get rejected. So exosomes, what are they? Why do we use them? So we include exosomes for all ASD treatments. They are byproducts of the umbilical cord stem cells. They're about 100 times smaller. They are acellular, so they don't have a nucleus. They don't replicate. They are very helpful in cell-to-cell communication. They're very effective for reducing inflammation. Exosomes could be the mediators of many stem cell-associated therapeutic activities. They don't have any issues crossing the blood-brain barrier to reach the central nervous system. All right, so let's go through a few papers. This was one out of China, transplantation of human cord blood mononuclear cells and cord-derived mesenchymal stem cells. This was a combination treatment in 37 autistic subjects. Patients received both cord blood and umbilical cord mesenchymal stem cells. There were no adverse events except for low-grade fever. Now, the significant changes observed included what we see: improved social and behavioral improvements. There was enhanced eye contact, less emotional and aggressive response, less hyperactivity, and significantly increased speech. At 6-month follow-up, the results were compared with the control, and considerably higher improvements were seen in the combo treatment group. If you go on our R3 Stem Cell YouTube channel, you can see a long testimonial success story with the Chima family. Their child has had treatment twice, and it was 7 years old before treatment, wasn't speaking at all. And now they speak a lot, and their behavior is much improved. So one of the more exciting clinical trials was done at Duke University here in the United States. They started these about 7 years ago. There was a safety study with 25 autistic children between the ages of 2 and 6. They did IV drip stem cell therapy, not intrathecal. We tend to use both. But they did between 10 and 50 million total nucleated cells per kilogram. That's a tremendous amount, but it wasn't all stem cells. This is umbilical cord blood, which has a lot of total nucleated cells that are not stem cells as well. They followed the children for a year, and they found that there were no serious adverse events. There was general improvements in the symptoms specific to autistic children, including speech improvements and verbal and nonverbal socialization skills. They also had decreased hyperactivity and decreased aggressive behavior. I wrote a guide to stem cell therapy for autism. It's available at r3stemcell.com/autism-guide. All right, it's a free download. It reviews all of the major studies and our experience around the world. Okay, so how do we price the ASD stem cell therapy? It depends on the cell counts. We use somewhere between 2 to 5 million stem cells per kilogram. The severity of ASD factors into the cell count decision as well. So the more severe the ASD, the higher the amount, the higher the factor for the stem cells. Here's a chart with an example. So for 60 million stem cells, our USD pricing is $47.50. That also includes, for free, 25 billion exosomes. And everybody gets a multivitamin IV drip and ground transportation from the airport. For 90 million stem cells, it's $6,250 US dollars, along with 50 billion stem cell exosomes and a free night in a hotel. We have like 3 hotels within a baseball's throw, from the clinic. Now, for 120 million stem cells, it's $77.50 US dollars. That includes 50 billion exosomes and 2 nights at a hotel. For 150 million stem cells, that's $10,750 US dollars. It includes 75 billion exosomes and 2 free nights in a hotel. Once again, all these procedures receive a free multivitamin as well as ground transportation. Okay. So here's our clinic in Manila. It's gorgeous. We have multiple treatment rooms on the 2nd floor. We have one on the lower floor in a conference room. So we have a highly skilled anesthesiologist who does our cases. We can also do conscious sedation and monitor appropriately, and we do allow a parent to be in the room. Okay, so we've been featured on every major media news outlet over the last 12 years. Since I started the company, we've done 24,000 stem cell procedures overall in 6 countries. Okay, it all starts with a free consultation. If you call the number that you see there on the screen, you can also visit us online at r3stemcell.com/Philippines. We'd love to speak with you, see how we can help your child or children. And thank you so much for watching.